Hello everyone, welcome back to my channel. It's Dr. Cece here again, and today we shall be busting myths about tuberculosis preventive therapy. So just sit back and let's bust this myth together. So first off, let's get to have a little knowledge about tuberculosis before we start talking and busting myths about tuberculosis preventive therapy. So first off, what is tuberculosis? Tuberculosis is an infectious disease caused by bacteria that can affect the lungs and spread to every other part of the body. Tuberculosis can affect anybody, but children under the age of 5 and adults who have a weakened immune system or adults who are exposed to people with active TB are at higher risks of contracting this disease. In Nigeria, tuberculosis remains a public health challenge. It's actually so sad. And what are these symptoms of tuberculosis? Persistent cough lasting more than 2 weeks, unexplained weight loss, excessive night sweat, and persistent fever. So these are the symptoms of tuberculosis. So now, let us dive into the tuberculosis preventive therapy. So what we're going to do today is, we're going to give ourselves a little quiz and see if you're able to get it right or not. Okay, first off, tuberculosis preventive therapy is actually a treatment given to people at risk of TB. So we'll be using some short forms like TB to represent tuberculosis, TPT to represent tuberculosis preventive therapy. Are we ready? Okay. So the first myth we shall be looking at is 1. TPT. Don't forget TPT is tuberculosis preventive therapy. So TPT is only for people with active TB. Myth or facts? Dun, 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 dun. So if you chose facts, you are incorrect. So actually, TPT is given to individuals who have latent TB infection. That is, these persons have the bacteria but don't feel sick. So it is given to them to prevent them from having the active TB. So there's actually no need to stigmatize anyone with TB or anyone taking the TPT. So let's go to the second one. So the second one is, if you feel healthy, you don't need to take TPT. Fact or myth? If you chose facts, you are incorrect for a second time. So just be scoring yourself. You are incorrect for the second time. So many people with latent TB actually don't feel symptoms. They feel like they are healthy. So that does not necessarily mean these people don't need TPT, because without the treatment of this latent TB, it can actually go to become active in future, especially for people with weakened system. So let's move on to the third myth. TPT is unsafe and can cause severe side effects. Myth or facts? If you chose myth, you are correct. So TPT is actually safe and effective. Though there are some minor side effects like nausea, fatigue that one can experience when taking this. But when you start experiencing severe and rare side effects, please do not hesitate to consult a healthcare provider immediately. Let's go on to the fourth one. How many have you scored so far? Let us even start from there. Have you scored 3 over 3? Okay, so let's go to the fourth myth. Once you start TPT, you will always take it for life. Myth or facts? If you chose myth, you are correct. Okay, so TPT is actually a short-term preventive therapy. It's a short-term preventive treatment. It's not like diabetes or hypertension, whereby most of their medications are usually for life. On a lighter note, this is warning to you that you are taking diabetes medication. I said, oh, my sugar is now fine. I don't need any other treatment again. Or I can now stop taking my drinks. This is not TPT. TPT, short term, but diabetes and the rest, long term. But don't worry, we'll discuss about that some other time in another video, okay? For now, let's just focus on TPT. So, we already said it's a myth. So, it's actually not lifelong and it's usually a short course of treatment. It's important to complete this treatment to provide a long-term protection against TB. Let's move on to the fifth one. TPT is not necessary if you have taken your BCG vaccine. Myth or facts? Yeah. I'm taking my BCG vaccine. I don't think I'll need TPT. After all, they said BCG is to prevent TB. Oh, is that not what we know it as? If you chose facts, you don't fail them again. Oh, you have failed again. Why the BCG vaccine can help prevent the severe form of TB in children? It does not completely prevent the latent TB from becoming active. So TPT is still very necessary for people that are high risk of contracting TB or who have the latent TB. Let's go on to the sixth myth or fact. If someone in your family has TB, you will surely get it, myth or fact. What do you think? For this, tricky, not 100%, because close contacts of TB patients are actually at a risk of contracting TB. But what TPT does it significantly reduces this risk. So taking this preventive therapy actually lowers your chances of having TB. Can we go to the seventh? Only people with HIV need TPT. What do you think? Well, while people living with HIV actually are at higher risk of developing TB, other individuals, like people that have close contact with people that have TB, are also at a chance of developing TB. So these people also need TPT. So how many have you gotten so far? How many? Let's go to the final myth of today. You can stop TPT once you start feeling better. What do you think? No. Stopping TPT early can allow the bacteria to boom. The malaria will survive, and it will not increase your risk of developing active TB. So you don't stop TPT because the minute you stop it, you allow the bacteria to survive and it increases the risk of you developing active TB. So what you have to do is complete the prescribed course to have maximum protection. So TPT is safe, it is effective and essential for preventing TB. Don't let any myth or misconception stop you from getting this therapy or this treatment. If you're at risk of TB or you come in close contact with anyone that has TB, please do not hesitate. Read my lips. Do not hesitate to visit your healthcare provider and get treated. So thank you once again for joining me today. If you found this video helpful or you enjoyed it, please don't forget to give it a thumbs up. And if you haven't subscribed yet, please hit that subscribe button now and join us for more interesting health tips, okay, and health topics. See you on my next video. Bye.